Being 10 a.m., I will call the meeting to order and turn it over to Calissa for roll call.
Thank you. Helen Claire Tingling,
Good morning, everyone.
Beverly Wilkins,
Here.
Don Murray,
Here.
Kenneth Craig,
Present.
John Richards,
Here.
and then Nick Saunders, Nick Saunders, Nick Saunders, Sue Carlton, Sue Carlton, Sue Carlton, Kevin Eccles, Kevin Eccles, Kevin Eccles, Andrea Matrosovs, Andrea Matrosovs, Andrea Matrosovs, Shirley Keaveney,
Happy to be here.
and Jay Kirkland, Jay Kirkland, Jay Kirkland.
So we do just have quorum for today's meetings. Move ahead with the agenda. I'll ask now if there are any proposed amendments to the agenda as circulated. Yeah.
Thank you. Through you, Mr. Chair. I'd like to add an agenda item where we could consider future staff report.
Okay.
Just for a future agenda item, not today, like.
Maybe ask. I point out before we go in camera, is that good?
It's fine.
Okay, so adding that to the agenda, I then move that, the agenda be approved as amended. Moved by Bev, seconded, second for that motion, seconded by Shirley, all in favor? That's, to be good, perfect. Perfect. Agenda. I'll ask them if any board members must declare any matters of pecuniary interest. There are none of the 9 board members that they can declare any as they arise throughout the meeting. On to item 6.0, we have the adoption of minutes from Friday, June 23rd, 2025, as well as the Monday, June 16th, 2025 executive committee meeting. Any discussion on any of the minutes together? Don?
I just had a question on the executive minutes, and we did talk about it on the way in. Just what constitutes a quorum when we, and I guess my only concern is I've been on 3 meetings on the board, and the chair was at the first meeting and left and hasn't been back, and now we run an executive meeting with 2 members. So I'm not sure where quorum comes in at 50%, if what the policy says for that.
I mean, Dr. Ara.
Yeah, certainly. So the executive committee is for individuals. So when there are 2, there's 50%. Historically, the same situation happened, and the meeting continued. Worth mentioning, this meeting had all the information to receive. No decisions were made. The committee is not making something new. They're just collating the information for the item and following a checklist that's prescribed clearly in the policy. So the discussion happened in the meeting whether we should proceed or not, and the decision was to proceed. And historically, there was the same situation about the same or similar items, and that continued.
Just in that regard, thank you, Mr. Chair. Would it, and if I may direct my question to our medical officer of health, would it be wise, like there are opportunities when there might be circumstances where there's only one person that is eligible because of a pecuniary interest or whatever it is. Is there some wisdom in clarifying the policy so that, in the event of, the inability to include full participation, that like we're pretty clear on, yes, one person can make the decision if it's a recommendation or if it's not a decision, but a recommendation back to the board so that business doesn't get stuck in a procedural pinch point. Is there wisdom to be able to clarify that so that like we're just here's the policy that if there's three on the executive committee, one person can make the ultimate decision. I'm not sure how that's guided through whether that's through the municipal act or the health and the technical persons act, whatever it is. If I could get some clarity about that, please.
Yeah, sorry, if you can elaborate, if there is only one person on a committee, if that's gonna function, that didn't happen before. There were occasions where
Yeah.
there's one person showing up and the meeting is canceled or postponed.
Yeah, but there's, if I may, in a municipal council setting, you can get down to two people on your council because everyone else has, like you asked her about the pecuniary interest, and that could be an issue that disqualifies people from the conversation, but you don't want to hand tie or the executive committee from doing the work. You know, they might discover it when they get into the process. So I'm just wondering if there's clarity that we could add to the policy so that, you know, in the event of a 4-member executive committee and there's 2 people there, go ahead. If there's a pecuniary interest and there's only one person able to do it, like acknowledge it, but don't stop the work. We need to have decisions made moving forward. So it's an attempt to facilitate progress and not to hogtie the sorry, back to the farm reference. To hogtie the executive committee from doing the work that they've been directed to do. I'm trying to put it in a progressive context rather than a negative.
Yeah, that sounds very good. I think it makes sense to review the policy as you described to make sure that there's nothing preventing the work of the executive committee going forward. Just functionally, how would you like for that work advance the
And that might just be through the regular review of policies. Like I'm not asking for a new review of this policy, but you know, as they are brought through the board, that might be a consideration to have in mind.
Yeah, sorry, I missed telling standard. Over to you.
Thank you, Mr. Chair. I hope to add clarity. The policy does just require 3 people on the executive, the chair, the vice chair, and a provincial nominee. For this executive round, other people wanted to jump on and contribute, and so that's great. But if I can respectfully say, the core is 3 people, so 2 is definitely a quorum. And the second that I would add is the executive is called at the call of the chair. So it's always when the chair can find it convenient and there is a canvas with those other executive members such that it should never happen. And in the 5 years that I have been on the board, greater than 2 on the executive, it never happened because 3 people are canvassed. The chair, it calls the meeting and 2 other people are canvassed. It should be the vice chair and a provincial nominee is the wording. And therefore, I just don't want us to spend a lot of time right now trying to address a problem that isn't a problem. Thank you, Mr. Chair.
I think that's not clear. Any other discussion on the minutes of this item? I guess Ken suggested ours to look back at our policies since part of our normal review of policies, so we can definitely keep that as a consideration going forward. So I would then ask for a mover and a seconder for a motion that the minutes from Friday, May 23rd, 2025, and Monday, June 16th, 2025, be approved by the Board of Health as presented. Moved by Bev. Secondary, Shirley. All in favor? Moving on to item 7.0, services report, we have item 7.1, draft 2024 audited financial statements. With a seeker mover and a seconder, that the 2024 audited financial statements be approved by the Board of Health. Seconded for that motion. And seconded by John. Any discussion over this item?
Mr. Chair, we do have Tracy Smith with us to
Oh.
do your presentation and walk us through the statements.
Oh, excellent, perfect. Over to you then, Tracy.
Oh, I'm here. There we are. Okay. Hello, I'm here. Can you hear me?
Yes.
Yes.
Okay. All right, I'd like to thank the board for having me here today. Kim, do you want me to share my screen?
Yeah, if you can, Tracy.
I am not the best at technology, so please bear with me as I try to see if we can do this. It seems to I seem to have quite a lag on my computer, so
It's showing for us, Tracy, on the screen.
oh, it is showing for you, okay? Because I can't see it. I can't see it on my um on my Teams meeting, but you can see it, Kim?
Yeah.
Okay. Okay, so if I get something on the screen that I'm not supposed to have on the screen, then please, please just let me know. Okay, so again, I'd like to thank the board for inviting me to your meeting this morning. I'd also like to thank Cam and our finance team for all their assistance during the audit. I am presenting today as M&P. And not BDO. So all the former BDO offices in Grey Bruce and surrounding area are now operating as M&P. M&P is a Canadian national firm with 150 offices coast to coast. M&P in Canada is actually almost twice the size of BDO in Canada. So we do have the training and the resources still of a national firm. So the report in your package with the fuzzy picture is the required communication to the board. This picture is supposed to be fuzzy. It's not a misprint. The fuzzy picture and the coffee mug with the logo are the standard on all M&P communications. So I'll provide just a brief summary of this audit findings report. It is similar to last year. It's similar to BDO, and that's because the content is prescribed by the accounting standards. So just as an overview, the draft financial statements need approval from the board before they can be released. That's the motion that you have on the floor at the moment. We confirm that M&P is independent of the Grey Bruce Health, Grey Bruce Public Health. So we can perform an independent audit. But materiality for the year was 475,000. We did not find any significant deficiencies. We did not find any deficiencies in the internal controls that we tested during the year. Other highlights from the report is that there was one unadjusted difference, and but it related to the retainer for the legal fees. So the retainer is expensed as part of your funding, but under accounting standards that would be a prepaid. So since this is not material, the summary of that is at the back of your letter here. So it's not material, so we can issue a clean opinion on the financial statements, which are in a separate package in your agenda package. So I'm going to try to see if I can switch to that. So bear with me as I try to switch to that. Okay, so let me see if I can get that. So can you please just verify that I do have the financial statements on the screen now?
Yes, Tracy, yeah.
Okay, thank you. So our audit report is on page 2. Management is responsible for preparing the financial statements. It's our responsibility as your auditor to give an opinion on those financial statements prepared by management. And an audit is the highest level of assurance that we can provide as a public accounting firm. And our opinion is in the second paragraph. In our opinion, the financial statements present fairly in all material respects. The position of the health of Great Bruce Public Health. I'm sorry, I'm still back with the health unit. And in accordance with Canadian public sector accounting standards. Therefore, it's a clean opinion, and we had no issues that came about during the audit to report back to the board. The rest of the audit report goes on to talk about the responsibilities of management and those charged with governance. And the second page is all about the auditor's responsibility for the financial statements, for the audit of the financial statements. The financial statements themselves are the responsibility of management and are prepared by your management team. On page 4 of the financial statements is a statement of financial position or the balance sheet. So that's a snapshot in time on December 31st of 2024, which is the year end of the organization. Total assets were 4.9 million and mostly in cash. The cash does fluctuate depending on the timing of the subsidies and the recoveries of those subsidies by the ministry. The funding to be recovered by the ministry does show here on the separate line in the liability section. It is broken down in note 3 by program. And so at December 31st, there was $540,000 to be recovered by the ministry for various years. If the funding is to March 31st, past the year end, then it would show in deferred revenue and be recognized in revenue in January to March. Total liabilities were $10.5 million, with the largest portion in long-term debt. So there are still 2 loans, one at 4.82% and one at 3.03%. Those are maturing in 2033. Under the new financial instrument standards last year in 2023, we did start recognizing the value of the interest rate swap on the loans, which was required under that standard. The net financial debt is your assets less your liabilities and represents the borrowing to build the building. The net debt is decreasing as the external debt is repaid. And in 2024, you repaid $979,000 in principal on those long-term debts. The accumulated surplus is broken down between operating surplus and remeasurement losses on the swap. The operating surplus that is essentially the capital reserve that's generated from the MOE rents. On page 5 is a statement of operations. It's transactions for the year. It is consolidated for all of the programs offered by the public health. Total revenues were 17 million, which is similar to the prior year. Total expenses were 16 million, and that includes 1 million for amortization. And it's shown here as a separate line. That amortization is not funded by the ministry. The annual surplus just want to highlight that is not the actual excess funding that's recovered by the ministry. The funding revenue that we record is matched against the expenses, and so any amounts to be received or recovered is shown on the balance sheet, and that due to the province. So this annual surplus, that includes the funding for the capital assets and the principal debt payments that are not showing as expenses on your statement of operations. The surplus here of $1 million, we take to the next page, and that is adjusted for the actual purchase of capital assets and the amortization of amortization capital assets is added back. So then the decrease in your net debt, is then used to pay down the principal, and the remainder is the MOE revenue that's accumulating as a small capital surplus. At December 31st, the capital reserve was, $2.6 million. So that includes a very high level overview of the financial statements. I'll just open it, if anyone has any questions.
Any questions for Tracy?
Through you, Chair. Actually, there's a couple or three comment first. I'd like to congratulate Dr. Era and the corporate services team. Excellent, well done. The thing that I appreciate about this budget, which is significantly different from municipal budgets, is the stability of the budget itself. Like there's no dramatic percentage changes in either the revenue or the expenses. So it is a predictable budget. And if there is a big change, it's like, oh, okay, wonder what's going on there. And there's a line or two, but put it in context and you understand what's going on. So congratulations, well done. Secondly, on note on page 18 of the report, there is a list of 7 in the accumulated surplus. There's a list of 7 accounts there that did not change 23 to 24. And it's more a question about the use of those funds. Are those funds in accounts that play communities in action, newsletter, workforce, stay in your feet, heart health, radiation, triage, healthy communities? Are those areas of action that were dormant this year, or were income and expenses exactly the same, so it didn't change? Or is that could you just comment on why there were no additions or detractions from those accounts, please?
So for you, Mr. Chair, so, so the smaller ones, so the ones in the 2,000-3,000, those were primarily dormant programs. Heart Health does still have some activity in it, but it didn't have any in 2024. And then the larger one, the Healthy Communities, it didn't have any activity in 2024, but there is a conference that's being planned, I think, for either end of this year or early 2026, and that's when those funds would be utilized. So if those smaller ones are dormant, but the larger ones are being used. So we would probably just clear up those dormant ones in a future year. If we needed, a few thousand to balance, we would just clear those up using those funds.
So may I continue?
Yes.
Okay, so I appreciate the value of your team administrating. I'm directing more to Dr. directing the programs. Are these programs that might come to the board and say, this was a great project in its day, but it just doesn't add value to public health these days, and we need to end it? Or is there opportunity for consideration that no, times are changing and we need to ramp up the funding? I acknowledge that the programs and the direction change all the time. So is there notification that we're just not doing this anymore? And it can be as simple as that, to say, well, we're not doing that anymore. And so when people ask or something, we don't do that. Could you just clarify direction on them a little bit, please?
I guess you can speak to the bring back to the board, but some are like the Let's Grow program, for example. That was we would print resources for the Let's Grow, so new families, so we print resources, and then we would Healthy would pay us for copies of those resources. And so now things have kind of gone by the way of paper and all that stuff. So we're seeing that money from that little bit of money that we gained from doing that, just kind of sitting there. So perhaps I'd hard to speak to whether we can bring that level of detail back to the board, but that's what some of these are from, are just little initiatives. They're not substantial programs. I think sometimes they're just small internal things that we were doing that generated a bit of revenue that didn't necessarily have to be returned to the ministry, so they ended up in equity and they're there for us. But they're not huge programs per se that we're no longer doing.
Yeah, if I saw healthy babies, healthy families on that list, that's a different question altogether. So that suffices, you know, for that answer, unless Dr.
Yeah, if I may add, thank you, Kim, I for everything Kim said, and add to it, build on it 2 layers. One of them is there are a number of partners who contribute to some of this funding, and they sit around the table. And for example, the Healthy Community, we have a conference every 2 years or a number of years, so we accumulate this funding to support that conference, and sometimes it's going to be dormant for a number of months. And the main part is, like, this is not the meat and potato of what we do.
No.
This is just on the side helping partners do.
It's a great. And one final comment, and this is more the board stuff. I can't remember whether we have passed a motion to identify our auditor for successive years. So I can't remember whether we had asked BDO or MNP or who we've asked, and I acknowledge that there would be succession agreements for if you buy the corporation, you get all that sort of stuff. Do we need to amend any motions to identify who our auditor is for next year?
Yes, agree, Mr. Chair. So we did do a formal procurement process back in 2022 for our auditing services, and BDO, now MNP, was the successful proponent. So they were a 3-year contract. So 2024 was the 3rd year of the 3-year contract. And within that contract, there was the option to renew 3 times for 1-year periods. So I have reached out to MNP to get a quote on the 2025 year, which I bring back to the board probably in July or August, whenever I get that information, and we can decide for appointment or going back out to RFP again.
Thank you.
Thank you. Any other discussion about the audit report? Seeing any, we did put a motion on the floor before the discussion with the financial statements be approved by the floor of thought. So all that questions, all in favor? It's very excellent. Thanks so much, Tracy, and thanks.
Thank you.
Perfect. Moving on to item 7.2, the financial report. I won't be thinking of a sequence this time. I'll turn it over to Kim.
Thank you, Mr. Chair. For you, this is the April 30th, 2025 financial update for Grace Public Health. As of April 30th, we were reporting a surplus of $384,000, broken down 249,000 in surplus in the mandatory programs and 155,000 surplus in our senior central program. Year to date, our revenues are slightly under budget, primarily due to the lower recognition of one-time funding in Q1 for the COVID-19 vaccine and RSV program. The municipal contributions from various counties are showing a little under budget, but those will align by year end. And our revenue from reimbursable vaccines, such as our HPV and MenC, that should catch up by the end of Q2 once we've completed the invoicing to the Ministry of Health, who reimburses those vaccines. Under the salaries and benefits, we are under budget by just over $76,000, and this is primarily due to the WSIB rebate we received in March. And we have had some temporary position vacancies while we've been doing recruitment. Our occupancy costs are in line with our budgets, and our operating expenses are generally under budget. Our Alpha membership was renewed in April, and that's reflected in the association of the memberships line. Our dentists and dentist in the senior benefit program remain under budget. And we're continuing to recruit for a permanent dentist. This is a new position, but we're hoping that will help with the budget utilization in the senior dental program. And we do have that team working to explore options on how to take advantage of the surplus that's currently there. In the capital plan, our interest on the capital reserve is exceeding our budget. We do have the window replacement and the Honeywell system upgrade projects that we're budgeted for and are currently underway. And that concludes the April financial update. I'm happy to answer any questions.
Okay. Any questions for Kim on the financial report? Kim?
Through you, Chair. Thank you for the report. It's not a questioning. It's all good stuff. Could you give me an idea, like the Alpha Association membership is significant, it appears. Can you give me an idea of what other associations the board for public health is actually members of?
For you, Mr. Chair, and Dr. Are you able to build on this one too? There's quite a few. There's associations for public health business administrators. So all of your corporate people, we get together and share information and ideas. And there's similar groups, I think, for inspectors and nurses. So pretty much all those public health associations we do participate and are members of. I would say that's the majority of them. There are
And why I could have things that I can't do it.
Yeah, okay. Thank you.
Yeah, there are questions about the financial report or comments? Seeing any, then we will look for a mover and a seconder for a motion that the financial reports for April 2025 be received out of the top for information. Moved by Don, seconded by Ken, all in favor? Moving on to item 8.0, correspondence and media releases. Start with media releases. Denny, so online, so Denny, read.
Thank you, Mr. Chair, and through you, there are 6 media releases on today's agenda. 2 of the releases serve as reminders about protecting against vector-borne diseases. The first relates to tick season in Grey Bruce and encourages residents and visitors to wear insect repellent and take other steps to prevent tick bites when outdoors. The best way to protect against Lyme disease and other tick-borne illnesses is to prevent tick bites. And the second release was issued after a crow found deceased in Bruce County tested positive for West Nile virus. This release urges people to take steps to prevent mosquito bites. 2 releases on today's agenda stem from the ongoing measles outbreak in Ontario, with the first explaining the steps public health takes when there's a measles exposure in a school. The other release advised residents about a potential measles exposure location in Grey Bruce. Public Health also issued media releases in June related to a dog bite incident and a release in May about the 25th anniversary of the Walkerton E. coli tragedy. And that concludes the media release report.
Excellent. And so, if there are any questions about any of the media releases for Denny? Perfect. We'll for a mover and a seconder with the media releases we received by the Board of Health for information. Moved by Bev.
I'll second, Mr. Chair.
Seconded by Helen Claire. Thanks, Helen Claire. Discussion on that motion. Being none, all in favor? That concludes 8.0, and we'll move on to item 9.0, the medical officer talk updates. Dr. Chief.
Thank you, Mr. Chair. There are 3 items. The first one is related to the opiate situation in Grey Bruce, and I'm bringing to the board an update from Alpha Symposium, the resolution that we submitted. And there was enough time in the agenda, since it's a late resolution, to be spoken to and has a minimal debate, or not minimal debate. It's enough debate, but not enough debate to have the motion to pass it. So it was tabled, most likely till September. And the impact of the debate on the resolution was substantial. I am very proud that we put this resolution forward. The chair spoke to it and held the crowd in a way I've never seen before. Right after a number of health units came to the outer table at the lunch break, 2 of them requested copies of the resolution and the impact statement to implement it right away, even if it's not passed. And even the people who had the potential friendly amendment to the resolution expressed their interest in voting for it when it comes back to the table. So that is a success on its own, and I do believe it's going to save lives. Open to questions about this item, Mr. Chair, before I turn to Shamir for the other 2 items.
Questions, Helen Claire?
Thank you, Mr. Chair. I apologize to everyone for my unfunctioning camera. And I just wanted to comment to, through you, how wonderful it is the work that our chair has done, particularly on this file. Having been involved in attempting to move a similar motion a couple of years ago, I'm very aware of the kind of robust discussion that can happen at Alpha, and it's not an easy thing to move things forward. But it is wonderful that we have such an articulate and committed chair to speak to this issue. Thank you, Mr. Chair.
Thanks, Sean, there. Yeah.
Thank you, Mr. Chair. Thank you, Dr. Eyre, for that report regarding Alpha. The other significant points that are in your report here talk about the significant decreasing trend related to opioid overdoses. And so first off, congratulations not only to yourself, but to the Community Drug and Alcohol Strategy team, the Community Wellness, help me out, Don, what's the name of the committee? Community Wellness? Community Safety and the leadership team on there. And so I'm not absolutely not recommending that we lessen our efforts. Is this a multi-pronged blanket approach that has been successful, or can you pinpoint one or two things that have been, in your experience, fundamentally essential to make a difference in this effort?
To you, Mr. Chair, that's a key question, but I wonder if we can address it right after the report. I believe you're referencing the harm reduction report.
Oh, well, there we go. Okay. I'm so excited about good work.
Thank you. And if I may add, there was another resolution related to having board member from the indigenous community on the Board of Health. So Alpha actually went to the step that what we have had for a number of years here. And that resolution was tabled as well. And I believe what our chair spoke to our resolution actually captures or supports that resolution. So I suspect both of them will be passed. Although it's not our resolution, I think you revived it, but
Yeah.
I will answer that question after the report.
Yeah.
I guess my question is, if we put our other hats on, how do we help as municipal people push this through? Like you said, it's been tabled. So what can we do either at our own municipal levels or at the county level to help move this along?
So it was tabled in the Alpha meeting, not in the parliament. So that's, I don't think the municipalities can need to influence that process. Plus it was tabled for one reason. It's a late resolution because the court conclusion for the trial that the impact statement that we are working on ended in April, I think, March or April, which is past the deadline for Alpha to submit the resolution on time. So it came as a late resolution, and with late resolutions, there's always a condition if there is enough time for it. So it's not an issue that we need to address other than revive it for September and give it enough time for discussion and debate. But thank you for.
So we may be able to get involved if it gets to the parliament level, if it needs help at the provincial level or somewhere. We could advocate for it at that time.
Or legislating.
Yeah. Okay.
But to that, perhaps, Dr. the next step in the Alpha process is there, you mentioned there a September meeting or a fall meeting of Alpha that this discussion would take place.
Correct. There are 3 symposiums, one in September, one in February, and the annual general meeting in June. So this can be revived in a special meeting during the summer or latest in September.
Okay. Excellent. That's good. Okay. And thanks again, echoing volunteers from the six to you and the chair for all your work. That's great that I felt you shown that level of leadership of those provincial programs. It's great. Great.
Thank you for your support. Without the board support, we can't send it forward, but truly the credit goes to our chair. This is the brainchild of his work, absolutely.
Great. Perfect. So for the remaining two items on the medical officer talk update, we'll move to Shamir.
Yes, please.
Perfect. Shamir, over to you.
Good morning, Chair, and good morning to members of the board. Through the Chair, it is my pleasure to present this report, which provides an update of the priorities established by the harm reduction team for 2025. This report is being presented for information purposes. The report highlights the significant decreasing trend related to opioid overdoses and fatalities in Grey Bruce since the start of 2025. For the first quarter of 2025, from January to March, we reported 15 opioid-related poisonings and 1 fatality. In contrast to 46 opioid-related poisonings and 8 fatalities reported for the same period in 2024. This report also highlights the 2025 priorities for the harm reduction team. These priorities are: 1, enhancing community safety and reducing harms. The team hopes to accomplish this through providing education and services, such as participation in community outreach events and supporting the distribution of rapid response drug test strips. The second priority is updating the Grey Bruce opioid response plan. The team will be accomplishing this by collaborating with other health units as well as local community partners to ensure that the response plan reflects current services and practices. And thirdly, the third priority is reducing stigma. The team hopes to achieve this through evidence-informed education, training, and communication, and by working with other community partners in facilitating and evaluating various educational materials that help to address stigma. In conclusion, the harm reduction program is pleased to note the excellent collaboration with different community partners to achieve the common goal of saving lives. With that, I'm available to answer any questions members of the board may have. Thank you, Chair.
Any questions with that production before that?
No question.
Already been asked. Any other questions for Shamir? Don?
Is there any link to the increased enforcement by our federal government along our borders, do you believe, to drug products? We're seeing a decrease. There's been a lot of things changed in the last 6 months. Is there any link to the increased enforcement?
Shamir or Dr.
Yeah. Through you, Chair, to board member. There has been a number of things that have been happening recently. It's difficult to pinpoint it on one thing. Yes, definitely measures in the border have been helpful. There have also been a number of measures locally and provincially by enforcement in trying to, they've been able to have some, the word I'm looking for, be able to address drug trafficking in different ways. They've been able to catch a number of drug dealers. So we've got that measure going on. But the other measures which we have noticed locally to the ability to improve housing. And one of the things we've noticed locally too is that a number of users are able to go on treatment and as well as being added to Suboxone, which is a drug that helps drug users. Then finally, one other thing we've observed that has been helpful is the distribution of drug test kit, which does help people when they use drugs to be able to test those drugs to ensure what they are taking and so that it reduces the harm to them. So it's difficult at this time, to be honest, to be able to say with certainty what could have led to this reduction. But then there's so many measures that are ongoing, and we're just pleased to see the decreasing trend, and we are cautiously optimistic that this decreasing trend will be sustained in the long run.
Thank you, Mr. Chair. To add to what Mary mentioned is we need more data to be able to decipher where the source of the benefit or the reduction comes. Our numbers are around 30 deaths per year, for example. And now we're mid-year and we have only 4 deaths, which is great. But we know that there could be tomorrow 2 events, each one of them number of individuals, and we go back to the average that we had. So we need sustained decrease over at least a year to say there is a decrease. Now there is potential decrease, more or less. And you look at the different variables that comes into it, and there are plenty of them. To answer your question specifically, could it be related to the federal changes related to the border or the threat of tariff that led to pressure on the government to close the border? Yes, there is potential for that. It could be one of them. The other one, it could be like Shamir mentioned, the local enforcement changes that case of trialing and sentencing the one of the main distributors to our area. That didn't happen yesterday. It happened 6-7 months ago, or the trial a year ago. So we might be seeing these result as a consequence to that. Locally, we've had multiple interventions related to the healthcare and social services, and we have been consistent with those over the past 2 years. And so is there net benefit from that? Definitely there has been. And how much of this can be attributed to the local enforcement or the federal enforcement? We need more data. I've been in communication with the chief of police, for example, for Owen Sound, and they do have data that they can share that's anonymized, where we can see if there is reduction in the distribution of drugs. If it is consistent with the same pattern of reduction in death, that can be more evidence that the reduction came from that intervention. But again, for 1 year of data collated, it's very difficult to say with confidence it's the healthcare system, it's enforcement. The really good thing to close that answer is we're trying everything we can with our partners to address this issue.
One, if we keep deterring them, like the sentencing of, if we can get the judges to give longer sentences, everything will help in the end. But it looks promising now that all the changes we've done or the governments have done are really helping. But as you say, it could change tomorrow, but we are 7 months into the year and we're only 4 deaths instead of could be 15. So something it's helping.
Well, thank you, Mr. Chair, and I really appreciate the conversation, and congratulations to the health unit. That's really quite a significant improvement. And all I can really speak to is Grey County, because that's what I'm here to represent. But I look at the different aspects of that partnership and what it brings, and the Bayview Center here in Owen Sound. That's 24/7 availability of support for people on the 14th Street, which is another dozen rooms and full-time supports. And we just bought the Diamond Motel last year, and we know that housed, I believe it's 487 nights of stay over the winter. And as Shamir spoke to, it's the housing, giving people a roof. And we just heard yesterday about staff that are now working on setting up some rooms in Dundalk to help people in that direction. We got the SOS program, and that's now being set up not just 1 day a month, but quite visibly outdoors on Mondays at our food bank in Meaford, so that people can walk right up and get support. So I really appreciate and congratulate all of those who are working together, because now we see success, and that's just really so incredible.
Mr. Chair, thank you so much for saying that. Like, I summarized it by the enforcement, by the healthcare system and social services, because the list is really long. And sometimes if we list a number of people, but we don't list the other, whether it's primary care, pharmacy, the NGOs, United Way, the SOS has all this group. So it's absolutely a collective effort from the three groups team.
And through the chair,
Yeah.
I think it's wonderful that people are all feeling a responsibility. They are our fellow man and woman. And it's really wonderful that people are saying, well, it's not sloughing. Now everyone is feeling, okay, this might be Charlie's cousin. And there is an onus then upon society. Be all right, we must pay attention, we have to find solutions. And in the public, there will be more and more where people are really trying now to collaborate. Even within their own systems, whether it's policing or whether it's public health or whether it's community, whatever, nursing care, welfare, whatever, social services. It's really wonderful that people are hearing the cry of those who need it. And we can't fix it all, I know that. Because that'd be wonderful if we had that kind of a magic wand. But realistically, no, we won't have 100%. But it's wonderful to feel ownership on part of this public. So, bravo, public, keep rolling.
And just to, through you, Chair, just in support, the title of the presentation is harm reduction.
Yes.
It is acknowledgement that we can reduce it. Will it ever be perfect? No.
No.
Harm reduction is the.
Yeah.
Well,
Right.
yes.
Perfect. And then the next report for the item 9.3 injury prevention and road safety program.
Sorry, Mr. Chair, just for clarity, just harm reduction is one program addressing this. There is prevention, there is enforcement, there are other. Harm reduction, just simply reducing stigma. So it's part of it. It's not everything we do, just to be complete there.
Good point. Thank you. Okay.
And on to item, Claire.
Thank you, Mr. Chair. I am just so heartened to hear Mr. Okoronkwo's report and also to hear the commentary to my colleague, Mr. Murray. I have been talking about the change at the federal government for a few years now and absolutely working on that. As our medical officer of health has said, it is a multifaceted problem and requires a multifaceted solution. And I believe that the wraparound care piece has been the piece that has been the slowest to join. We've been really seized as a large community with harm reduction and what we've understood that to be loosely based on the Portugal model a long time ago, and just taking one piece out of that. Whereas absolutely, as my colleague Ms. Keaveney and Ms. Wilkins said, we have to take care of people, give them what they need. And as I have said before around this table, nobody dreams of growing up and becoming a drug addict. So we need to understand the complexity of this and understand that, yes, stopping at the border, yes, harm reduction, yes, addressing adverse childhood experiences, and yes, attempting to give the basic human rights that human beings need. All of those things knitted together and other things will help us address this problem. And no, we'll never attain 100% because people will come and go in those stats. But it is fantastic to be on a board that is tasked with trying to solve the problem. And I just wanted to tell everybody around the table how much I appreciate all of you. Thank you.
Thank you so much, Ellen. I appreciate that. Excellent. It's a good way to move that discussion, and we'll move on to item 9.3, injury prevention on road safety program. Shamir, for that update as well.
Thank you very much, Mr. Chair. Through the chair to members of the board, it is my recommendation that the Board of Health receives this report, which provides an overview of the key initiatives developed, implemented, and evaluated by the health promotion team related to on-road safety for information purposes. The report highlights the leadership provided by the health promotion team to the Regional Road Safety Committee since 2020. This committee is made up of interdisciplinary professionals from across Southwest and Central Ontario. Between 2020 and 2021, the committee was able to implement several strategies that led in 2021 to significant decrease in stunt driving, and in stunt driving charges in Grey Bruce. This decrease has been sustained over the past 4 years. In 2024, the committee was successful in securing a grant from Community Foundation Grey Bruce to support the campaign to address cannabis-impaired driving in the community. Over the coming months, the committee will be working with local stakeholders to raise awareness of the risk of cannabis-impaired driving and promote a safe ride home. In conclusion, providing leadership to the Regional Road Safety Committee provides the health promotion team an opportunity to collaborate and liaise with road safety professionals across southwestern and central Ontario in ensuring the safety of our roadways for all users. With that, I'm available to answer any questions members of the board may have.
Any questions for Chair Hoffman?
I just like how it mentions Highway 6. Likely lots of people in the room know about the lottery that was running for a number of years from T to T, where the purse could get up to 35,000 for a competition to see who could make it the fastest from Toronto to Tobermory. It was like an underground lottery, and that's where a lot of these things were coming from. And to me, enforcement is the only way to do it, and we are cutting it down, but it's hard to believe what people will do for money sometimes. Yeah. Rent a car and away you go.
The report's quite timely too, we enter these levels of traffic on the particular highway and around the region. So,
yeah,
thanks, Shamara, for that update, for the work that you do. Excellent. So with that concludes the medical update. I'll look for a mover and seconder with the medical officer health updates to be received by the Board of Health for information. The mover for that motion, moved by Bev, seconder by Helen Claire. Any discussion on that motion? All in favor? Excellent. So now we'll move on to item 10.0, which is as we amended the agenda at the beginning of the meeting. Over to the agenda.
Thank you, Mr. Chair. I would request the staff's assistance. In my request here is to present a review of the org chart. It's not my desire in any fashion to amend it. That's not the point. It's just to understand it, to understand the as whether it's an open and closed, that's your decision, but vacancies that affect program delivery, challenges in hiring, or, the structure, the value of what the structure looks like to present ongoing, just to give myself and hopefully the board a better understanding of how and why and the challenges of program delivery based on our organizational chart at this point. And that's for a future meeting, whether it's July or August, September. It's where it fits in. That's all.
So thank you for the request. It's part of the board orientation, the second session that was delayed from March to now. It's going to be scheduled. I believe Kalisa sent out a request to find out the date that would work for everybody. Built into that session is the review of the strategic plan and what we need to do to address certain things. And the organizational chart would be part of the discussion. And also you mentioned the HR changes and recruitment. The last month's in-camera HR report would include all the parameters around recruitment, how long to it's take us on average to find no recruiters or the turnover in the organization, which is, again, like I mentioned last time, it's below industry average, below Canadian average. And, all these things would be in that report, and they were in that report, and they will be in the discussion for the strategic plan that will happen in camera as well.
Okay, there we go.
For motion that will address that in the upcoming meeting. Perfect. Any discussion on that item? Great. All is good. Perfect. Thanks, Ken. So now on to item 11.0, which is our in-camera session, and I would seek a mover and a seconder for the following motion that the Board of Health go into closed session at 11, clock just changed, 11 a.m. to discuss the adoption of in-camera minutes, one item on labor relations and employee negotiations, and 3 items related to personal matters of an identifiable individual. Further, that Dr. R. Kim Rutherford, Denny, and also shall remain present. Mover and a seconder for that motion. Moved by Shirley, seconded by Bev. Any discussion on that motion? Seeing none, all in favor? And it's carried. Perfect. So just give a second to change over. All right, we're back from our in-camera session. Confirm me that we only discuss the items that were placed on the motion to go into camera, and the direction was provided to staff on those items. And with that, to item 11.0, which is looking for a mover and a seconder that the Board of Health meeting be adjourned at 11:56. Moved by Beth, seconded by Ken. All in favor? It's carried. Now, thanks so much, everyone.
Thank you, everyone.